Hey, it's Mike from Purity Health and Wellness. We're going to talk about foam rollers, and if you don't have one, you probably should get one because they're super helpful. We can roll out lots of areas in your body, but really specifically your glutes, your quads, your hamstrings. They're really important because they affect everything from knee conditions like patellar arthralgia to sciatica to piriformis syndrome to just general low back pain. So first I'm going to show you how to stretch out your glutes and your piriformis and external hip rotators. So basically those muscles all attach from the midline, they all attach to the outside. So really our focus is these muscles through here. The foam roller, really the intent is to push into these areas so that we can get the muscle to relax. So the way we could do this is find hard ground, no beds or no soft tables. We need something firm to be rolling on. Basically, you're just going to sit on it depending on your pain tolerance, depending on how tender it is. You're going to roll around until you find some pretty good knots. And this is usually the position that we would get into, almost like a line but with a little bit of rotation, just so that most of the pressure is going through that area. You're just going to be rolling from anywhere from 2 to 5 minutes, depending on your pain tolerance, of course. And then if you find a really sore spot, hang out there a little bit more. It's really helpful. The second muscle that's really important is your TFL. Your TFL basically is this guy right here, and it attaches and actually goes into your IT band. So a lot of people, when they talk about rolling out the IT band, it depends on what you really believe, but it's a it doesn't contract, it's non-contractile tissue. So if this muscle is tight, it actually can tense up that IT band, causing a lot of outside knee pain. So almost the same as the glute stretching or rolling that we were doing. It's the exact same thing, except your pressure is into this muscle that we were just talking about, the TFL. So you'd be basically lying on your side, rolling around until you find a really tender spot, holding that. But again, this is a smaller area. You really can't spend too much time in this, but maybe a minute or two would be plenty. You could also roll into kind of the front position because that TFL comes right through the front of the hip. So front and back, again, spending a couple minutes doing that. The other muscles that are really important are your hamstring and your quads. Your hamstring is important because it attaches to your pelvis. If it is tight, it will throw off the rotation of your pelvis. So it's a really good idea if you're doing this anyways, to roll out your hamstring. Easy way to do that is basically seated. You're going to put the other leg on top just to add more pressure in through that bottom leg, and you're just going to roll back and forth until we find some tender spots. You should be doing the outside of the hamstring and the inside of the hamstring by just turning your foot in and out. The last muscle we're going to talk about in through this category is your quad. Your quad's really important because it controls your kneecap position. So if you've heard of the term PFA, patellar arthralgia, it's oftentimes attributed to glute tightness or glute dysfunction, also quad tightness and quad dysfunction. So even if your pain is into your lower back, it's really good because again it attaches to the pelvis. An easy way to do this is you're going to basically be doing almost a plank position. You'd be going all the way from the top of your hip, right here, all the way to your kneecap itself. But you're just starting on the top of the hip, you'd be putting some pressure into this spot, and then basically crawling forward, like you're crawling under a barbed wire maybe, and then you're going to be rolling back and forth in through this. Again, you really should be targeting the inside of the hip and the outside of the hip when you're doing that, and it should be discomforting, not painful. But if you need any more help on foam rolling, let me know and I can help.